Heart disease is the #1 killer of men and women. Heart health has a huge impact on pretty much every aspect of your body and mind.
The only way that I can describe it, and now of course I know what it is, but I was doubled over, I couldn't stand straight, and I was taking breaths almost like you would through a straw. That was as much as I could because the pain was so severe.
You don't have to make these massive changes in life to get results.
You're not alone. And our goal as a medical community is to make it so that this part of your life, this medical diagnosis, is just something you're gonna have to deal with. The rest of your day really should be to not think about it and really go about your life.
Your heart will beat about 100,000 times today, but how many of those beats are gonna be healthy ones? Hey everyone, I'm Rich Dorment, the editorial director of Men's Health and Women's Health, and this is The Future You, our show about the new frontiers in health, longevity, and building longer, stronger lives. Today we're talking about a topic that is close to everyone's heart, because, it is your heart. Because no matter how fit you are, or how young you feel, your cardiovascular system is quietly writing your body's long-term story. The choices you make today, how you eat, train, manage stress, even how well you sleep, can either protect that story or cut it short. Here's the reality. Nearly 1 in 2 American adults, about 47%, have high blood pressure. Every 40 seconds, someone in the US has a heart attack. And heart disease still kills more Americans than all cancers and accidents combined. So what really determines heart health in 2025? What's hype, what's habit, and what's new in how men and women prevent, track, and treat it? Today, I'm joined by 2 incredible guests sharing their own heart stories. Plus, Dr. Sunil Rao, a cardiologist at NYU Langone Health, who's going to break down the latest science on keeping your heart strong, resilient, and ready for the long haul. So in studio today, we are thrilled to be joined by Carly Pearce, Grammy-winning country music superstar. You're also a heart health advocate, and you've been spending the last year at this point really speaking about your own experience and advocating for early diagnosis, honest conversations with your physicians, and showing your heart a little love at every age. So before we get into all that, I want to take a step back and figure out how vitality played into your life from the very beginning. Were you an active kid? Were you an energetic kid who was always running around?
I was a really active kid. I wasn't very athletic, if you will. My dad would tell you that. But I was always running around. I was always in theater and dance and all kinds of things.
Singing into your hairbrush type of thing?
Always.
And was that a big part of your identity? That idea of just being able to do all those things and being active and overactive sometimes?
Yeah, I think I was a busy person. I always thrived being busy. I was in all the extracurricular activities plus singing on the weekends. And so I thrive on being busy, and I think I've always been that way.
And here you are, a performer.
Yes.
You're out on the stage. How long is your usual show these days?
Probably on average 75 to 90 minutes.
That's a lot of time.
It's a long time.
Even if you just sat there still like Adele, that's still like that's a lot, but you're moving around.
Hard. Yeah,
it's hard. So how did you prepare? How did you used to prepare for that as far as being in your best shape to really be out on the stage and be there for your fans?
I started running when I was 19.
Okay.
And so I became an avid runner. And I think that cardiovascular endurance training that I didn't even really know I was doing at 19 has really helped me as I've become a professional performer. And running around on stage really isn't that hard because I really do care so much about exercise and care so much about diet and care about just making sure that I'm running so I can run all the way around the stage.
And when you're on the stage, do you ever feel tired, or is it just like the adrenaline's like you're just there and it's all happening?
I feel like I get tired if I have like a new song that I haven't really worked out yet, so the breath isn't there.
Yeah.
But no, I think at this point I'm pretty aware of how much I can move, how much I shouldn't move, what parts of a song I can move on more than others.
Right. Okay. So maybe 5 or 6 years ago, things started to feel a little different.
Yeah.
Tell me about those first times when you sort of started to feel maybe it was a shortness of breath, maybe it was a tightening in the chest. Something was off.
Yep.
What was going on?
In the summer of 2020, I was going through a lot of personal changes and noticed shortness of breath trying to walk up a hill. And
had that ever happened before?
Never happened. I was always very healthy, never had a chest pain. And I noticed this stabbing pain. And my father, he had a widowmaker heart attack when he was 44. So
oh my gosh.
of course, I immediately go to worst case scenario, and I'm like, oh my gosh, chest pain, am I okay? And went home, and it kind of didn't subside. And I talked to my parents about it, and they were like, well, you're just under a lot of stress. It's probably anxiety. It's probably in your head, or just what you're...
And your dad even said that,
My
having
dad,
had that.
That's an important part.
Yes.
Because I was a young,
Right.
healthy
How
person.
old were you at the time?
I was 29.
Right. So who's thinking about their heart health at 29? Everybody should. But
They
they're,
should.
But they're not, right?
Yes, exactly. I think a big reason why I'm sitting here is because I feel like you think your age, or if you're healthy and you exercise and you eat right, no way it's going to happen to you. And so I ended up going to the doctor because it just wasn't subsiding. I was trying to run, and I was running on it when my body was clearly telling me no. And I was dismissed by the doctors. They were like, it's stress. You're going through a lot. You're fine.
You're 29. You're in great shape.
Mm-hmm.
All right. So Dr. Rao, we hear this a lot, and we hear it a lot with women in particular, with physicians not really listening to patients. Heart disease is the #1 killer of men and women.
Yep.
And it has, even when it's not heart disease, heart health has a huge impact on pretty much every aspect of your body and mind. What kind of heart conditions should everyone, but particularly women, be thinking about if they're having shortness of breath or chest pain? It doesn't always go straight to, heart attack. What should they be thinking about?
Yeah. So I'm sorry that you were dismissed. I mean, that's really concerning. So I think, chest pain or chest discomfort, shortness of breath, the first thing we think about is, do you have coronary artery disease? That's a disease of cholesterol buildup in the blood supply to the heart muscle. That's the #1 cause of heart attacks. That process occurs throughout our body. It can cause strokes. It can occur in other blood vessels. So the reason that we think about that first is because, #1, it's underdiagnosed in women. For a long time, even during my own training, we were told that being male is a risk factor for coronary artery disease.
Wow.
Being male is being a risk factor, period. But yes, but for
right.
heart.
So now we are finally getting aware that it's just as common in women as it is in men. And the classic signs and symptoms of a heart attack were described in men. And so women can present a little bit differently. Oftentimes they can feel more fatigued than normal. They may have, bouts of nausea that they can't explain. And that can be, ascribed to the heart. So it's important to have what we call a high index of suspicion. If someone is presenting to you as a physician with those kinds of symptoms, no matter, if they're a man or a woman, if they're, anywhere above the age of 18, you got to start thinking about ruling out coronary artery disease, because it is the #1 killer. The second thing is that there are treatments for that. We can actually treat it. We can help people live longer. We can get them on medicines that really are designed to reduce the risk of future heart attack, future stroke. And then, once we've kind of ruled out those things, we got to start thinking about other things that could be causing it. And those are inflammatory conditions that can lead to inflammation of the heart muscle, inflammation of the lining of the heart muscle. And again, those are important to diagnose because, again, there are treatments for those, and there are ways to reduce the recurrences of those kinds of things.
So when we're talking about the top 5 warning signs that something isn't just stress, or it isn't just something in your lifestyle, so what should women in particular be thinking about or keeping an eye on?
Yeah, so it's a great question. I think the key is, if you're not able to do what you normally do, that's a big warning sign, right? Especially if it's sudden onset, you've got to start thinking about, is there something going on? And, even in today's society where we kind of like to think of ourselves as more enlightened, women still bear the burden of managing the household in most parts of the world. And so it's not unusual for women to dismiss their own symptoms and say, my priority is my family or the kids or my husband or my wife. And we just, it's important for women to make their own health a priority. And if you're noticing these signs and symptoms that are different, unusual, limiting what you can do, it's really important to go seek medical attention.
So Carly did that, and they told her to go home.
Yeah.
And then what?
Several times.
Several times?
Yes.
Same physician several times?
Yes. I ended up I went back, I believe, on the 3rd time. I had gone, all my blood work was regular. So they're like, you're fine. It's stress.
Can I ask you,
Sure.
Did they examine you? Or was it kind of
Was this over Zoom?
But I mean, did they examine you?
Yeah.
Or did they just kind of dismiss you outright?
This is a common theme with me. They, for some reason, they cannot detect the recurrent pericarditis without an EKG, apparently.
Yeah.
Or at least in my case, that's when they found it. So yes, I was checked and blood work, went home, went to dinner, and fainted at dinner.
Oh my goodness.
And the only way that I can describe it, and now of course I know what it is, but I was doubled over. I couldn't stand straight. And I was taking breaths almost like you would through a straw. That was as much as I could because the pain was so severe. Went to the ER.
And what do you think is going on?
I think I'm having a heart attack for sure.
Okay.
Yeah. And this was 2020. And I get to the ER and they do an EKG. They thought I had a blood clot in my lung, and came back and they say, you have pericarditis. I was like, well, what in the world is that?
Yeah.
And, they just started to explain it to me, and they were like, take some ibuprofen, you'll be fine. Well, that wasn't really enough for me.
Right.
It scared me.
Yeah.
Sure.
But of course, I kind of went back to normal after a couple weeks, and this continued to happen, and what I call them are flares. Over the next few years, I had a few flares, but I didn't have the big flare until the summer of 2024. And very similarly, I had that feeling. I was on a photo shoot, and the pain, it was different this time, but it started kind of over in my rib, and it started to come. And as soon as it made it here, I knew what it was. Mm-hmm. Couldn't walk up the stairs, like you said. Like, I was having a really hard time doing just simple activities that shouldn't be hard. Walking up a flight of stairs. I got to my doctor's office, and I, at this point, at least know that I have had pericarditis.
Right. And did you know that it was recurrent?
No.
They didn't explain that to you?
Mm-mm.
So they're different
No,
grades.
I never even heard of that.
Well, how do you explain it? Let's have two definitions. How do you explain it to, like, so what's going on? What is a peri what? Like, what is it? What is it?
Oh, no. The way that I would describe
No,
it.
this is good. This is good. This is good.
Pericarditis is your heart is inside of a sac, and the walling or the lining of that can get inflamed. Mm-hmm. And there's also something with it for me every time when I have these flares called a pericardial effusion, where there's fluid that can fill in that sac. Mine, thankfully, has not been as severe as I've heard other people's. But yeah, I mean, that's, to me, it's just the lining, and you get relief when you bend over, but lying down is much harder because it's pressing on it.
That's pretty good. I'm going to steal that.
Yeah.
That's pretty good. That's a great explanation.
But they're different. They're different types, right? There's acute, which is probably like the episode that you were talking about.
That's what I thought.
Yeah. And then you have recurrent, right? That just sort of comes, I guess, flares is another, that's a really good way of putting it. Yeah. And sometimes it does just kind of happen once, right? And you take ibuprofen and it kind of goes away.
And it goes away. I mean, there's this sort of relapsing, recurring kind of syndrome. The long term, what we worry about is this inflammation leading to some kind of scarring, right? So it's really important when you have recurrent pericarditis. I actually have a family member that has recurrent pericarditis. And it's important to try and really treat it very quickly to stem that inflammation. The way my family member has it is that they feel very, very fatigued for about 2 days, just really washed out, just can't get up and go. And then they know that it's coming on. So they can take the medication, kind of, they get that, kind of preamble of it. And they can take the medication and kind of reduce the severity of it. But it's really important to reduce the recurrences. And there's plenty of medical therapies now that can do that, because long term, it can lead to scarring of that sac around the heart that can lead to issues downstream.
Who was the first person you told about your diagnosis?
My diagnosis, my dad. My dad became quite the resource for my anxiety just around, because like you said, I've had different flares throughout the years where I go, oh, I know what it is, but I can control it if I catch it with, ibuprofen or whatever, and go about my life. But these two flares, the one in 2020 and the one last year, they really scared me, and I had to go to the ER. And this past one, they thought I was having a heart attack in the doctor's office because my EKG was reading either about to have a heart attack or currently having a heart attack. And that's when I was told recurrent. And so you think about it and you're like, oh my gosh, I have an issue with my heart.
Right.
That's not good.
Right.
And so my dad, he's been a really good just resource of understanding what that anxiety can bring when you feel a chest pain. Maybe I run too hard or push it too hard, and then one comes on and I'm like, oh my God.
Or like there's a weird like palpitation.
Yeah.
Right? There's just weird,
any kind of, like, I could be sitting here with you guys, and if I had one little chest pain, I'd be like,
sure.
Is it happening? And he's been really helpful.
That's good. Yeah.
Well, he's been there, right?
Very much so.
I mean, I feel like in those days and weeks following a diagnosis, particularly of what could be a chronic condition, you're like, all right, well, this is great. Like, this wasn't on my bingo card. How did you start to absorb that and adapt to it, both from like a medical Like, did you start a specific regimen, or, whether it's, medication, or did they tell you had to change your lifestyle? Was there something like you can't perform as often, or you have to run less, or anything like that?
Well, when it happened, I was in the middle of over 40 city tour with Tim McGraw.
Yeah, sure.
Super fun.
Sure. Happens all the time.
And they're like, you need to keep your stress level down and rest up. And I was like, let me tell you what I do for
Right
you.
on top of that.
And so I had to completely alter my life for an entire summer.
Yeah.
And this was the first time, and this is another reason why I'm so passionate about this, is because don't ignore the signs. Because I was like, oh, I'm fine. I can start running again at full speed. And it's like, no, you can't. And this is the first time that I was like, you get one heart, and I want to make sure that I take care of it, because it's clearly angry at me at times. And so I completely stopped running, which was psychologically hard. But I found that walking is nice. But I had to keep my heart rate below 110, which as a singer, sometimes when you're just standing like Adele, your heart rate is above that. Yeah. And so it was kind of it's why I went public with it. I still wanted to be able to put on shows, but I also was like, my shows are going to look different. And so I didn't run around the stage. And I had a lot of anxiety through that. And I was put on a lot of medication that didn't make me feel very good, which I now know I don't have to do. I was put on a steroid that was really, really prednisone, very, very high dose of it, which makes your heart rate speed up. And it was just a challenging time. But I think what got me through that was kind of coming out with it and being honest with people, and knowing, again, if I would not have advocated for myself, I would have never even probably had that diagnosis. And who knows? Not that people regularly have grave issues from pericarditis like they would a heart attack, but who knows if I pushed my heart to a degree, what could have happened. But I just didn't take no for an answer. And I've had so many people, even a girl that I grew up with that I hadn't talked to in years. She reached out to me and she was like, I'm dealing with the exact same thing. We're 35, healthy runner. She's dealing with it. And so it's like, so many people, it's a lot more common than I thought it was.
Yeah. And that helped you process some of that anxiety.
Yeah. It was like a community.
So you've given not great diagnoses to countless men and women over the years. And how do you counsel them in the days and weeks afterward, as far as adjusting mentally and taking in this news so that it feels more manageable and it's leading someplace good?
Yeah, I think the hardest part of getting a diagnosis, and look, I have a child that has type 1 diabetes. So, I think it's that feeling that you're completely alone. Like, I'm the only one who's got this. I'm the only one who's got to deal with this. This is going to completely change my life. And then there's a period of time where you start realizing, okay, I can deal with this. And I really want to congratulate you for advocating for yourself. It's such an important lesson that we have to I think really tell the public, is that it is really important to take control of your own health and advocate for your own health. If you're not getting the answers that you want from your care provider, your physician, really insist on getting those answers. So what we tell patients, and we give patients, unfortunately, life-threatening diagnoses. Luckily now in modern medicine, we can treat a lot of those conditions and make people live longer, is to let them know that there are options. You're not alone. And our goal as a medical community is to make it so that the rest of your day really should be to not think about it and really go about your life. And our job is to make sure that it doesn't affect your life.
For a long time, there was this stigma around heart problems, and that somehow, like, whether it's through lifestyle or diet or whatever, like, I did this to myself, right? Like, I didn't take care of my heart. Do you see that narrative changing, particularly as patients become more and more, and the world becomes more and more educated about these different conditions?
Yeah, I do see it. Now, look, we have to be honest, there's still a lot of people who don't take care of themselves. They don't control the risk factors. It's important to do all that. We're getting smarter about, the genetic causes of some of these diseases. We're getting smarter about novel risk factors that we hadn't thought about before. There are some new serum blood markers that we're measuring now. Eventually, I think by the end of this year or by the summer, we're going to have therapies for those. So we're getting smarter about this all the time. And it's really important for people to realize that, a lot of patients who have heart disease, it's not really anything that they did.
Right.
It's not because you decided to have an extra cheeseburger last month, right? I mean, it's really about the fact that It's part of the human condition. It's part of genetics. I mean, there have been mummies found in ancient Egypt that have coronary artery disease. It's just part of how, we're affected. And so the key is to not focus on kind of, those kinds of negative thoughts, but really think about how to get better and to, adhere to an important lifestyle modification, being active, taking your medicines regularly, eating right. I think all of those things can help.
Yeah. And you have folks like Carly who have been so proactive and positive in sharing their story.
That's a huge thing that you're doing, I think, for the clinical community is, is to be open about that. I think it's really helpful.
And living your life, right? Like, tell us about how you're feeling today, what your routine is like. How is it different than it was maybe a few years ago? How is it better? How is it maybe not as good?
I might not go guns blazing at an 11 on the treadmill, or I might be okay with somebody in a workout class outdoing me.
Yeah.
That's an adjustment. That was, I've always been that driven person that wanted to be the best. And I now listen to my body, and maybe I run some days a 9-minute mile instead of a 7:30.
It's pretty good, Carly.
That's pretty good.
I used to run so much, my longevity, I'm not running as many miles as I used to, and just kind of finding a new rhythm and a new normal, and just being more aware that you're not invincible. I think for me, I've just always been like, oh, I'm healthy, I'm good. And trying to just be proactive about, okay, if my heart has had some things that have put it into distress, let's not push it to the limit. And it's funny, especially as a female, you're like, well, if I can't work out to this degree, my body's going to change. No, it's not.
Right.
There's plenty of exercise. And what's ironic is through the time where I couldn't run at all, I found other ways. And I still was able to exercise that part of my brain that needed that outlet.
There are proactive steps we can be taking to whether prevent or manage heart issues. What are, other than diet and exercise, although I'm assuming that diet and exercise are big parts of it, what are some things that we can really prioritize, particularly women, as their bodies are changing, as their hormones are changing? How can they sort of future-proof their heart so that they can either forestall or manage some of these issues?
Yeah, I think the American Heart Association has this great thing called the Life's Essential 8. Kind of controlling risk factors. So if you have high blood pressure, make sure you control your blood pressure. If you're a smoker, whether it's
maybe
tobacco, you got to give that up, right? I mean, that's an important thing. Get your cholesterol controlled. That's really important. There's a lot of mythology around cholesterol. It's pretty clear that high cholesterol is a big risk factor for heart disease. Getting it as low as possible is really important. And then in terms of lifestyle, like you said, it's really important to eat healthy. What do we mean by eat healthy? I think diets are hard to stick to. I know from personal experience, they're really hard to stick to. So I think that it's important to treat yourself every once in a while, but try to eat whole foods, try to, maintain a healthy fiber intake. That's really important. Exercise is important. And I think when we talk about exercise, I really like what you said about the fact that walking is important. Walking is great. Movement is great. You don't have to go out and run 20 miles. No. You can walk for 20 minutes at a time. Just a few times a week, and that's enough. It's just really important to just get active and control your weight. That's a really, really important aspect. I think what's happening now is really remarkable. We've seen this revolution in pharmacotherapy for obesity, and I think that's going to be huge for the future health of Americans, really.
So we're fortunate today that we're going to be able to bring in a different point of view and a different lived experience. We're going to be joined by Shaun White, who has he's a little known, I think he's an ice skater, I think. Can someone prompt me? No, he's obviously the Olympic gold medal winning snowboarder. Shaun White, welcome. We're so happy you can be here. Everybody knows Shaun. He's the most famous snowboarder in the entire world. He's a 3-time Olympic gold medalist. He is an X Games champion. He is an inspiration to little redheads around the world that they too can be a sports star. You were born with a condition called tetralogy of Fallot. It is a congenital heart defect.
Yeah, I mean, the shorter version is that you have 4 chambers of the heart, and my chambers were leaking. I was losing oxygen.
This was right after you were born.
This took a second. I was probably about almost 1 year old or shortly after being born. And so they brought me in and obviously was diagnosed with this condition and, had multiple surgeries to correct it. They had to go in and stitch up those holes and things. And
now you obviously don't remember the surgeries. You don't remember any of that. When do you first remember thinking or realizing or knowing that your body was sort of built a little differently than the other kids around you?
So I always felt a little different. Obviously, I was only like redheaded kid in my class. I had this giant scar. So yeah, early on, I felt very unique in that sense, but I didn't feel like it held me back.
And you think that's because your parents just sort of like let you out and let you just be a boy?
Yeah, they let me really find my own boundaries. And I think they felt like they came so close to losing me in the beginning of my life that they're like, well, we're on bonus time now. We got to just let him live if he's going to live.
You didn't go into golf, or you're not a chess player. You went into like one of the most extreme sports, something that is literally not for the faint of heart. And so it's this really extreme example of what's possible for those with congenital heart conditions. Was there ever a part of you, knowing about what was going on, that thought, maybe I shouldn't do this?
I don't know. When I found the sport of skateboarding and snowboarding, or it found me, it just really was that perfect match. Yeah. And it is a strenuous sport, but there are elements of it that, you take the chairlift, we're riding downhill, right. Obviously skateboarding, a vert ramp, you're generating all of that momentum yourself. So it is really taxing on the body. Yeah, I don't know. It just really fit my sort of, my everything at the time.
Tell me a little bit about how you approach heart health from, a daily lifestyle point of view, from a sort of annual physician point of view. Like, how do you actually live with this knowledge, and what do you do with it?
Yeah, well, look, I think it's important to have regular checkups. It's one of those things where I think people get nervous of, well, what if I find something, or what if the scores aren't what I'd hoped, or, there's a nervousness around it, but it's better to be in a position to find something early on and have time to correct it. You don't have to make these massive changes in life to get results. Everybody thinks like, oh, I have to give up this thing that I love forever. And it's like, no, it's just moderation. It's like, if somebody used an example of, if you're flying on an airplane from New York to Los Angeles and you change the heading just slightly, you can end up all the way down in Mexico. A subtle change over time can get you, to some pretty amazing places.
And you're spending a lot of time in retirement. I don't actually believe you're retired, but we'll call it retirement. Really raising awareness around the condition that you have, but also congenital heart disorders in general. Tell me a little bit about that work.
Honestly, I didn't really think about what my parents went through until I got a phone call from Jimmy Kimmel. His son had a similar condition to mine, and his newborn at the time, and was sending him in for these corrective surgeries. And he told me, he's like, "You're the first name they talk about," and it really helps families to hear that there is hope, that there is someone out there like yourself that has been able to achieved so much with this condition. And watching his opening monologue, and he's crying, he's talking about it. And I was finally at the age where I'm like, oh, wow, my parents went through this. I've worked a lot with St. Jude Children's Research Hospital down in Memphis. Amazing place. And they do so much for the families there. And I put on a skateboard demo. I met all these families, and I was 16. I was just blown away. They allow families to have a normal life while still having one child undergoing corrective operations, treatments, things like that. There's another company that I worked with called HeartLink. Idea behind this is that there's only so many places in the world that offer these types of corrective surgeries. And instead of just pouring money into fixing specific areas with these surgeries, actually the money goes into training people on how to do these operations. And then they send them to underserved communities to help people out. So those are the big ones that I've really leaned into in my life, and proud to be a part of.
A lot of people watching this are going to be middle-aged, think they're in great health. Maybe they'll go to their annual physical and they'll get some not great news, whether it has to do with cholesterol, whether it has to do with HRV. What's your message for those people who sort of discover that they're about to go on a journey with their heart health and they don't really sort of know where it's going to end?
I mean, look, I was fortunate enough to have this happen so young that I wasn't in that position, but it's a road that twists and turns, and from having accidents where I ripped my face open, I'm in the hospital in New Zealand, to months later I'm standing with the gold medal around my neck. Like you think some things are the end of the world, and it's not. It's a time to dig deep and to learn about yourself. And when it comes to the heart and heart health, obviously eating well, exercising, getting your checkups, because by the time you're having symptoms and things aren't feeling well, it's really far down the road.
Right.
So you want to make sure that you're in, getting these regular checkups. Just make it a part of your life. Like I said, these small things you can do to change this outcome, and you can do it now. You can do it today. So I really say go in and check in on your heart, how you're doing, get your blood tested, all those things, and really start focusing on it, because it is one of the number one things, heart disease in the United States, especially.
Make it a priority. Well, Shaun, that's all I got for you. Thank you so much for joining us. Enjoy the LA sunshine, and we'll see you back sometime soon.
Thanks for having me. Cheers.
Thank you. He talked a lot about getting screenings and getting checked. And I'm of two minds of it. One is like, I really don't want, I want them to say nothing. I want them to say like, you're totally fine. But then when they do say something, you're like, I knew it, right? Like, you're like, I want an answer.
Yeah.
What are some of the screenings that men and women should be getting, and when should they be getting them? And then when we talk about the everyday data we all have access to because of these things, whether it's resting heart rate, whether it's HRV, what should they be paying attention to?
Yeah, it's a great question. I mean, it's actually fairly simple when you think about it. You should be seeing your physician or your care provider, once a year. Probably starting in your 30s. When you turn 30 is probably a good time to start doing that. Get your blood pressure checked. Make sure that's under control. Get your cholesterol checked, and there are different kind of targets depending on whether you've got a history of heart disease or you've got a family history of heart disease. I think the heart rate variability and the fact that we've got all these wearables now that allow us to check our heart rate and see if it's irregular, those are important. But it's also important not to overreact to those things, right? Because they're constantly monitoring things. Your heart rate's going to go up and down. If you're doing a big show, your heart rate may be very high. If you're just kind of sitting around, it may not be.
Not mine.
Resting heart rate of 80.
Wow, yeah.
I would.
So, the lower your heart rate is, as long as it's regular, it just sort of is kind of a sign of heart health. So you'll see people who are marathon runners who have resting heart rates of 48 or 50. So those are the kinds of things I think it's really, really important to get screened for. And the issue with heart disease is that it can start developing when you don't have symptoms.
Sure.
Which is why you want to get screened. You want to catch it before you have symptoms. I think what Shaun said is really important. When you start having symptoms, it's pretty far down the road already.
We didn't talk about sleep. Should we talk about sleep for a second?
We should absolutely talk about sleep.
Carly, do you like to talk about, are you like obsessed with sleep like the rest of us?
I should sleep more than I probably
okay.
do.
You're one of those.
Yeah, so
You're
maybe
one of
I need
those.
to hear it.
Okay. What role does sleep play in all this?
It's incredibly important. And I think we're learning a lot more about it. I mean, sleep itself is like over $1 billion industry now, right? I mean, everyone is chronically sleep deprived. Some of it is our own fault. We've got these screens that we're constantly looking at. But, I think it's really, really important to get sleep. There are associations between lack of good quality sleep, not just, the amount of sleep that you get, but how good is that quality? Are you waking up constantly? And the development of things like high blood pressure and heart disease. So, getting good sleep is really, really important. And what I like to tell patients is good sleep hygiene. So what does that mean? Don't look at your phone an hour before you go to sleep. Make sure that you're not going to read in bed. You're not going to watch TV in bed. The bed is for sleeping. Other activities that we're not going to mention. But, you want to make sure that when you go to sleep, you want to stay asleep and really get good quality sleep for at least 7 to 8 hours.
It's the good quality sleep that gets me.
Me too.
Yeah. When they'll be like, you slept, had a deep sleep of 35 minutes last night.
Terrible.
You're like, oh, it's another thing I'm falling short
Right,
on.
Yeah.
right.
What can we do to, optimize the quality of our sleep other than hygiene?
Yeah.
Is there anything?
So exercise helps, believe it or not. It actually does help your sleep quality. I think making sure that you kind of separate when you go to sleep from when you ate your last meal is helpful. There are some supplements that help, actually, believe it or not. There's some reasonable data behind something called magnesium glycinate that helps. We were talking about that
Knocks
earlier.
me out every time.
So that seems to help. Some decent data. It's very safe to take.
And that is good quality sleep.
Good quality sleep.
Okay.
It helps you kind of stay asleep.
Yeah.
Yeah.
Carly, you're living with this new reality. You're still out performing. You're still out being a country music superstar. Many women today are going to get bad news from their cardiologist, from their primary care practitioner, about something's going on with their heart.
Mm-hmm.
What do you want to say to those women, as they're coming out of the doctor's office and they don't know who to talk to, they don't know what to think? As someone who's been in that place, what are you going to say to that person?
I've partnered with the Life Disrupted campaign, and why I wanted to do that is that your life can go on and you can live a very full and happy life if you just are mindful of your health. Good on that woman or that girl for going in and getting checked, because I think being able to pinpoint what's going on is the first step, and being able to take the steps to make sure that you can live a good and full life. I don't think about recurrent pericarditis all the time because I'm aware when that happens, I know what's going on, and I'm educated now because I've taken the steps to make sure that it doesn't completely take over my life. It's just a part of it.
Mm-hmm. And as far as advocating, patients, women in particular, advocating for themselves, making sure that they're being really listened to, would you recommend typically getting a second opinion? You know, if they get an unsatisfying answer, they just feel like something's wrong and the doctor, you know, whether it's the tests or the doctor, it's just not showing up. Should they get a second opinion?
I always encourage second opinions.
Mm-hmm.
You know, any physician who discourages second opinions is someone who's not confident in their own abilities.
Mm-hmm.
You know, if someone sees me and they want a second, I say, please go get a second opinion. Let's, try and figure out if we're going on the same path. So absolutely. And I think the cardiology community has done a better job of recognizing, I should say the clinical community in general, is doing a better job of recognizing how symptoms and signs may be different in women for certain types of heart disease than in men. But we have a lot more education to do, I think, on all fronts, really.
Yeah. Well, one of the things about NYU Langone Health is that you guys are really at the cutting edge on not just clinical care, but research, aftercare. What are you, I mean, there are a lot of things you can talk about, but what are you most excited about as far as your job, your patients, and allowing them to live longer, stronger lives?
You know, what I'm really worried, so what I'm really excited about, so I do procedures for a living. I treat patients who are having active heart attacks. Mm-hmm. I look forward to the day where I can get a good night's sleep and not have to come in. So I am really, really excited about prevention. And there's so much going on in preventive cardiology right now. Like I said, new targets, new medications targeting, these serum markers that we didn't even know about when I was in training. And I think that, these research trials that we're doing now, if they pan out, are going to have a huge impact on reducing the burden of coronary artery disease, which from a population standpoint is great. But from that individual patient standpoint, I think is really, really meaningful.
Thank you so much for being here today. It's wonderful to see you here and in such good health. And hopefully Dr. Rao will never have to see you as a patient.
Well, and I just want to say, I'm looking in that camera. You know your body better than anybody, better than any doctor, better than anybody. If it is telling you something, listen to it.